Yeah. So next we have Dr. Nishanth, who's going to talk to us about image-guided cataract surgery. Go ahead.
Thank you so much. A very good morning. Being the first session, thanks Aditya for giving this opportunity. So this session is actually, I think, about the future of ophthalmology. I would say that it's not the future. We are living in the future. I think by the time you finish these 3 days, you will know that how image-guided phacoemulsification is much needed. So no financial interest. So we know that the cataract surgery has far improvised from the older technique of manual marking. So we know the toric we used to have the devices where we used to either mark in the slit lamp or we used to keep it horizontally and make the patient sit and mark. So those days are gone where we have the image marking system for astigmatism, which is very precise, and diopters and the overall protocols both preoperatively and intraoperatively have a very significant altered in the postoperative outcomes. So this is a Callisto which I'll just talk about in detail, where we have the toric marker which shows the direction of the toric lenses which we are going to place. You need not mark 0 and 80. You need not put any stain on the dye, or you don't have to put any marking with your needles. So this image guided technology, whether it is through an integrated cataract suite like the Callisto, which is by the Galsdale's company, the Verion by the Alcon, and the True Vision. So it can be used for alignment, abrometry, and it can be used for even IOL selection and alignment. So this is the Zeiss Callisto system, which have the three most important feature of any phacoemulsification. One, the incision. Two, the rexus size and the centration. And three, the Z align for the toric marking. So it is usually integrated along with the IOL master, where you get all the data, the toricity of the lens, and all the aberrometry values from the IOL master, and then you integrate it into the Callisto eye system. So it customizes and incorporated biometry based on a swept source technology into the integrated surgical module while operating. So it also detects the iris pattern and the limbal pattern as well. So this is a, I'm sorry. In the end, if I have time, I'll show you the video. So it's not only what we say should be followed. I think we have literature review and published reports which says that the effect of image guided system in phacoemulsification with intraocular lens implantation is much better than manual marking. So there's also an image guided lens extraction study which says that it seems to be an accurate and reliable technology where the measurements with high repeatability and reproducibility. I think as cataract surgeons, these are the two words which we want most importantly, that is repeatability and reproducibility regarding the keratometry and IOL power calculation. So there is a greater accuracy in the toric alignment as well, where it shows that the IOL misalignment was significantly less with digital marking rather than manual marking. In the comparative evaluation of the toric intraocular lens alignment and the visual acuity with image guided surgery and conventional 3-step manual marking, it was concluded that the image guided surgery allows precise alignment of the toric IOL without the need for reference marking, and it was associated with superior visual acuity, which correlates to the precision of the IOL marking. So the lesser deviation from the TIA in comparison to the manual marking, it says that in conclusion that the Varion system has an advantage of preoperative planning, intraoperative digital guidance of the toric IOL alignment, the use of Variant system which resulted in less postoperative deviation from the TIA and shows less postoperative toric IOL misalignment. So thanks to Dr. Aditya for showing that it is not only with the normal microscope, you can also integrate the Callisto to the three-dimensional microscope. So you're having the best of both worlds. And then about the fragmentation, we had Supriya talking about the MyLoop. So this is an amazing instrument which also does the fragmentation, but it does in a micro level. So the catalase laser system performs multiple scans of the eyes with all dimension and are displayed to the initial laser system. I have a video which I will be showing in the end. So we can customize what kind of fragmentation we can do it, whether quadrant wise or multi-quadrant. We can even do a limbal relaxing incision. We can do the size of the rexus. Everything is done within a 30 seconds period. I have it in the folder, sir. I'll show it. So yeah, we have literature reviews which shows that the Callisto, using the Callisto with the catalase, it also gives a perfect post-operative outcome, and the use of phaco energy is very much less compared to what you're using manually, because the lens are already fragmented into multiple pieces, be it whatever density of the nucleus. The best is using image guided even in an implantable phakic lenses, where the most important is actually the vault. So while operating, if you can actually intraoperatively know what is the vaulting, you can decide whether it is going to be a small ICL or whether it is too large where the vaulting is very high. So intraoperatively itself, you can take a decision whether the ICL is of perfect vault and size. So, in conclusion, image guided surgery assisted surgeons perform precise steps by displaying an overlay of incisional axis, rexus size, and the toric alignment. The outcomes are much superior in comparison to manual marking. The FLAX technology used OCT based imaging technology to map the intraocular structure prior to rexus and lens fragmentation. So, always assess both the technology to determine the benefits and the worth of the investment in your practice. Thank you. If possible, the video, just one video.
We're short on time, Nishant, so I think we'll move
Sure.
on. Okay.
I just had 1 minute, so I thought I'll just show one.